He studies calculus, plays video games. He runs cross-country for his high school team. Austin Clark is a typical American teen, except for one thing.
I never know, when it's just going to hit, because sometimes it's just out of the blue, random.
The hit Austin is referring to, Crohn's disease, a chronic inflammatory condition of the bowels that affects perhaps 700,000 Americans.
The most common symptom is at some point you will develop a change in bowel habits.
In most patients, that means frequent diarrhea accompanied by abdominal pain and even the passage of blood. The symptoms, as Austin Clark knows, can be life-altering.
It's embarrassing just having to get up and go to the bathroom all the time, and then people are just like, oh, he's going to the bathroom again.
Dr. Vijay Yajnik co-directs the Massachusetts General Hospital Crohn's and Colitis Center. He says that while doctors have a better understanding these days of Crohn's disease, they still don't know what exactly causes it.
There are parallels to autoimmunity, but it's not an autoimmune disease. It's a chronic inflammatory disease.
There is no cure for Crohn's disease, but Dr. Yajnik says the symptoms can be managed using medications, and the sooner treatment begins, the better.
We know if you treat early enough, we can really control the disease. Patients are in complete remission, not just somewhat better, they're actually completely normal.
Some of the more effective drugs used in Crohn's disease are known as biologics. They are given by intravenous infusion about every 6 weeks.
Quality of life improvements are dramatic, and the healing of the intestine is dramatic.
Austin Clark is one of those Crohn's patients using a biologic drug. He says it works to a point.
After 4 or 5 weeks, it ends up to wear off, and then I have that week where I'm not doing so well.
During that week of not doing so well, Austin would like his peers and family to remember this.
I have a disease. I can't control it, and there's no cure. So I just have to deal with that as best as I can.
In Marlborough, Massachusetts, Jim Morelli for CNN.